Hi everyone, in this video we'll solve CPC exam practice questions from ICD 10 CM. In your CPC exam, out of 100 questions, you will get 5 questions from ICD 10 CM diagnosis. Let's begin. First question. When a patient has a blood test for HIV that is inconclusive, what ICD 10 CM code is assigned? Option A Z21, option B R75, option B B20, option D Z11.4. The right answer will be option B R75. According to the guideline present in Chapter 1, Certain Infectious and Parasitic Diseases, patients with inconclusive HIV serology but no definitive diagnosis or manifestation of the illness may be assigned code R75, that is inconclusive laboratory evidence of HIV. So the right answer will be option B. Option A is wrong. Z21 is for asymptomatic human immunodeficiency virus. Option C B20 is wrong because that is for human immunodeficiency virus HIV disease. And Z11.4 is for encounter for screening of human immunodeficiency virus. That is also wrong. The right answer is option B. Next question. A 50-year-old patient has been diagnosed with elevated blood pressure. The patient does not have a history of hypertension. The correct ICD 10 CM code to report this is, check option A R03.0. R03.0 is for elevated blood pressure reading without diagnosis of hypertension. In this scenario, the patient has been diagnosed with elevated blood pressure. The patient does not have a history of hypertension. So, R03.0 is matching with the question. We'll keep this option for now. Let us check other options. Check option B I10. I10 is for essential primary hypertension. But in the scenario, they have not mentioned hypertension diagnosis. So, we cannot code I10. We'll eliminate option B. Option C I13.0 is for hypertensive heart and chronic kidney disease with heart failure. That is also not matching. We'll eliminate option C. Coming to option D I15.0, which is for renovascular hypertension. That is also wrong. The right answer is option A. Elevated blood pressure without diagnosis of hypertension. Read the question. A patient presents to the rheumatologist with rheumatoid polyneuropathy with rheumatoid arthritis of both hands. Choose the correct ICD 10 CM codes. Let us check the first codes from each option. Check option A M05.341. M05.341 is for rheumatoid heart disease with rheumatoid arthritis of right hand. But in this scenario, rheumatoid polyneuropathy with rheumatoid arthritis is mentioned. So, M05.341 will be wrong. Directly eliminate option A. M05.342 is for rheumatoid heart disease with rheumatoid arthritis of left hand. That is also wrong. So, option A is eliminated. Coming to option B, M05.231, that is for rheumatoid vasculitis with rheumatoid arthritis of right wrist. So, that is not matching with the scenario. So, we'll eliminate option B. Coming to option C, M05.141, which is for rheumatoid lung disease with rheumatoid arthritis of right hand. So, that is also wrong. In the scenario, they have mentioned rheumatoid polyneuropathy, not rheumatoid lung disease. So, eliminate option C. Check option D, M05.541. That is for rheumatoid polyneuropathy with rheumatoid arthritis of right hand. You can check in the scenario, rheumatoid polyneuropathy with rheumatoid arthritis of both hands. So, M05.541 is for right hand and M05.542 is for rheumatoid polyneuropathy with rheumatoid arthritis of left hand. Because they have mentioned both hands here, we are coding for right hand and left hand. So, option D is the right answer. Next question. Patient delivered full-term single live birth with no complication. What is the correct ICD 10 CM codes? Check option A, first code O90.3. O90.3 is for peripartum cardiomyopathy. But in the scenario, they have mentioned patient delivered full-term single live birth with no complications. So, O90.3 is wrong. directly eliminate option A. Coming to option B, OAT. OAT is for encounter for full term uncomplicated delivery. Code OAT should be assigned when a patient is admitted for a full term normal delivery and delivers a single healthy infant without any complication. In the scenario, the patient delivered full term single live birth with no complications, so we have to code OAT. That is the right code. Let us keep option B and C for now. Check option D, O35.0 XX1. But O35.0 is for maternal care for suspected central nervous malformation in fetus. But in the scenario, they have not mentioned anything as such. So, directly eliminate option D. We are left with option B and options Z37.1 and Z37.0. Z37.1 is for single stillbirth and Z37.0 is for single live birth. You can check in the scenario. Single live birth is mentioned. So, we have to use the code Z37.0. We'll eliminate option B. Remember that there is a guideline. Z37.0 single live birth is the only outcome of delivery code appropriate for use with OAT. Next question. Before solving this question, don't forget to show your support to my channel by liking, sharing and subscribing to CodeMed Mastery. Read the question. A patient with type 1 diabetes with diabetic retinopathy is seen for an eye checkup. After a thorough examination, the ophthalmologist determines the patient has retinal edema. Choose the correct ICD-10 CM code. I will mark the main term, that is type 1 diabetes with diabetic retinopathy is seen for eye checkup. And the patient is having retinal edema. Check option A, E11.351 is for type 2 diabetes mellitus with proliferative diabetic retinopathy with macular edema. And also a seventh character is needed in this code, but E11.351 is for type 2 diabetes mellitus. In the scenario, they have mentioned type 1 diabetes. So directly eliminate option A. Coming to option B, E10.9, type 1 diabetes mellitus without complications. But in the scenario, patient has type 1 diabetes with diabetic retinopathy. So, it is not type 1 diabetes without complications. So, eliminate option B. Coming to option C, E13.9, check the code. E13.9 is for other specified diabetes mellitus without complications. So that is also wrong. They have mentioned type 1 diabetes with diabetic retinopathy. So we cannot code for other specified diabetes without complications. Okay. So eliminate option C. We are left with option D. Check the code E10.311. E10.311 is for type 1 diabetes mellitus with unspecified diabetic retinopathy with macular edema. You can check type 1 diabetes with diabetic retinopathy is seen for eye checkup and the ophthalmologist determines the patient as retinal edema. Retinal edema is also known as macular edema because macular edema is swelling in the part of retina. So E10.311 type 1 diabetes mellitus with unspecified diabetic retinopathy with macular edema is the right code. Option D is the right answer. Next question. You can pause the video and try to solve the question by yourself. Let's discuss what codes according to ICD-10 CM guideline describe a patient that has hypertension with left heart failure. Check option A, I10. I10 is for essential primary hypertension. I11.0 in option B is for hypertensive heart disease with heart failure. I11.9 is for hypertensive heart disease without heart failure. And I50.1 is for left ventricular failure, left heart failure. So among these codes, the appropriate code according to the scenario, that is hypertension with left heart failure, is I11.0, which is for hypertensive heart disease with heart failure. We'll eliminate option A, I10, which is for essential primary hypertension, and I11.9 will eliminate, it is for hypertensive heart disease without heart failure, but in the scenario they have mentioned heart failure. So eliminate option C. We are left with option B and option D. They have the same codes, but in option B, I11.0 is mentioned first, I50.1 is the second code. In option D, I50.1 is the first code, I11.0 is the second code. Below the code I11.0, you can see they have mentioned use additional code to identify type of heart failure, that is from the code range I50. So, first we have to code I11.0 hypertensive heart disease with heart failure, and we have to use additional code to identify the type of heart failure, that is left heart failure according to the scenario I50.1. So option B will be the right answer. We'll eliminate option D because the sequencing is wrong. Next question. Read the question. A pregnant female at 21 weeks is diagnosed with iron deficiency anemia and is seen to the clinic for transfusion. Select the correct diagnosis code. Check option A, O99.012. O99.012 is for anemia complicating pregnancy, second trimester. In the scenario, they have mentioned the pregnant female at 21 weeks. So, 21 weeks come under second trimester. Right, so O99.012 is the right code. But according to the scenario, a pregnant female is diagnosed with iron deficiency anemia. So we have to use additional code to specify the condition. So we'll eliminate option A because they have mentioned only O99.012. D50.9 is for iron deficiency anemia unspecified, but they have mentioned D50.9 with Z34.92. Z34.92 is for encounter for supervision of normal pregnancy unspecified second trimester. But in the scenario, a pregnant female is diagnosed with iron deficiency anemia. So we cannot code for Z34.92, that is encounter for supervision of normal pregnancy second trimester. So eliminate option B. Coming to option C, O99.012, we check the code, that is for anemia complicating pregnancy second trimester, that is right. Then D50.9, which is for iron deficiency anemia unspecified, and they have mentioned the code Z3A.21. Check the code. Z3A.21 is for 21 weeks gestation of pregnancy. In this scenario, they have mentioned 21 weeks. So option C is the right answer. In option D, they have mentioned D50.9 and O99.012 as the second code. But remember that the chapter 15 codes, that is pregnancy, childbirth and puerperium, that is O codes, they have sequencing priority over codes from other chapters. So we have to code the O codes first. And also in option D, they have not mentioned the weeks of gestation code. So we'll eliminate option D. Option C is the right answer. Next question. What is the correct ICD-10-CM code for newly diagnosed multiple cutaneous Kaposi sarcoma lesion in previously diagnosed HIV disease? In option A, they have mentioned Z21. But Z21 is for asymptomatic HIV infection status, which has to be applied when the patient without any documentation of symptom is listed as HIV positive. And we should not use Z21 if the term HIV disease is mentioned, or if the patient is treated for any HIV related illness. So here they have mentioned multiple cutaneous Kaposi sarcoma lesions in previously diagnosed HIV disease. So we cannot code for asymptomatic HIV. So we'll eliminate option A. In option C also they have mentioned Z21. So eliminate that. Now we are left with option B and option D. Both have the same codes, B20 and C46.0, only the sequencing is different. C46.0 is for Kaposi sarcoma of the skin. Above the code C46.0, they have mentioned code first any human immunodeficiency virus disease B20. So we have to code B20 first. So option B is the right answer. Option D is wrong. If the patient is admitted for HIV related condition, then the principal diagnosis should be B20. I hope you're clear with it.